Well, hey, everybody. Happy Friday. Glad to have you along with us. Oh, I can't believe I said that. Happy Friday. I hear people say that. Happy this, happy that. Well, it is a Good Friday, I guess. Not the Good Friday, but it is a Good Friday. What people say, if it's the real Good Friday, do they say happy good?
Or greatest.
Good Friday, I guess. I don't know what they say, but anyhow. If you've read my Twitter X, I say on there is a disease that's hundreds of years old, but it still persists, and it's at near epidemic levels in the state of Mississippi. And you know what it is? Syphilis, for heaven's sakes, folks. And I was not aware of this, and I saw a story, really I saw it online yesterday or the day before, whenever it was I saw this. Channel 16 had a nice report on it about who's going to do something about this. And it's a terrible thing. And I thought, that sounds like we should do something on that. I knew that we were scheduled to have Kenneth Stokes on the show, and he had some other things come up, and we'll have him in a couple of weeks. I thought, oh, man, we need to do this story on syphilis, for heaven's sakes, of all things. And so, and it reminds me, like 20 years ago, we had our exchange student from Germany, and she said one day, Mary, why are so many young girls pregnant? And I said, well, because nobody talks about it. And she said, why? And I said, well, that is our Puritan heritage, and you'll be learning about that in school, because she was going to be going to high school here. And that was then. And here we are, these many hundreds of years later, 20 years after all that, and it's still pretty much the same. So sitting opposite me is Deja Abdul-Haqq. She is the director of My Brother's Keeper. And that is a nonprofit organization that focuses on public health. And you have been seeing, and welcome to the show, Deja.
Thank you so much, Mary.
Been seeing a hike in this since COVID. What is going on?
Well, first, thank you for having me. It's an honor to be here.
I'm glad you can be here. Yeah.
Like you said, when it comes to sex, we really don't talk a whole lot about it. And our infectious disease rate reflects that. So right after and keep in mind, sexually transmitted infections, we've had higher rates of chlamydia, gonorrhea, syphilis, HIV for a while. In 2022, Mississippi ranked 4th in the nation with HIV. So this is all because we are, one, engaged in condomless sex, and we're not talking about it at all.
Why not? Well, it's the most logical thing to talk about.
Well, like you said, we're in the middle of the Bible Belt. Outside of marriage, people aren't supposed to be having sex. And when you're in a marriage, you're in a monogamous relationship. So you're not having sex outside of the sanctity of your marriage. But the fact is, that's not actually what's happening. Young people are engaged in sex. People, elderly persons, 50 plus are having sex, and we're not having sex with condoms because we're really not talking about condoms. But the science has evolved so much that there's actually medications that you can take in order to, prevent, like specifically when we're talking about congenital syphilis. If a woman has syphilis and she gets a screening, she can actually receive medication so that the baby isn't born with syphilis.
Yeah, that's the difference between regular syphilis and congenital syphilis,
right.
which is passed down to the child from the mother.
Exactly.
Well, you have children, and I bet your kids knew exactly, because you're a logical parent, and you would tell your children what's what and what to do and what not to do.
Well, I'll be honest with you, Mary. I had a challenge with that. I have 3 boys.
Ooh.
I'm a woman, so I don't have a penis. So penis management wasn't on my radar. And I would ask Dad, hey, could you have this conversation? Could you have this conversation? And he would, be really paced about it. So I had to do it. But I had to refer to some of my colleagues at Open Arms Healthcare Center. I wanted to talk about, placing the condom on. What's the new science? Because science evolves. The best way to do things, best practices. So I had that as a gift. A lot of parents don't necessarily have that expert on hand to say, hey, this is how you start the conversation. This is how you talk about, putting on a condom. This is how you talk about PrEP, which is a pill you can take once a day to prevent HIV. This is how you talk about DoxyPep, which is a new prevention method that you can take a pill once a day to prevent syphilis, gonorrhea, and chlamydia. They're new sciences to talk about. So I had that expert on hand. I have sympathy for parents. A lot of parents don't necessarily have that person to have access to give them that state of the science information.
Well, without, I'll be charged with being an anti-male. However, there are, I think, a lot of men who think that condoms aren't cool, or they're in the middle of getting ready, and why do I have to stop and do this, and stuff like that. They don't like that, do they?
Well, hey, it's a choice. But if you're a Mississippi specifically if you're in Jackson, we have higher rates of STIs and HIV. You have to take that into consideration. I'm having sex or I'm engaging in sexual encounters in a place where the rates of STIs and HIV are high. I have to do something to protect myself and others. And, the condom really never did anything bad to anybody. I don't know why it gets a bad rap, because we're not talking about sex as much. We're not talking about sexually transmitted infections, and we're not talking about prevention. And condom is one of our old, trusted, and true methods of preventing STIs.
But if you're 14, 15, 16 years old, you're going to stop and think, now, I don't want to get da-da-da-da-da. You're in the middle of, hey,
I know.
That's the trouble.
And that whole concept of, like, I like to use the analogy when I'm talking to young people about their hormones and wanting to have sex but not really engaging in sexual practices that are safe. Imagine I'm in the kitchen and I'm cooking. I just started cooking and it smells really good. Mm-hmm. And you come in and you say, ooh, I'm ready to eat, right? I could give you that food, but you're going to get sick because it's not done. It's not time. That's the conversation I like to have with young people. I know your hormones are telling you to do this, but it's really not time. You're not educated enough about it. You're not your safe practices. You haven't had that conversation. That really needs to be drilled into young people's heads. Use condoms if you're going to engage in sex. If you're going to engage in condomless sex, consider PrEP, the pill you take once a day to prevent HIV. Consider DoxyPep.
Well, where do you get that? I don't know how to get it.
Well, that's okay.
That's another
here
one.
We go. Well, Open Arms Healthcare Center was established in 2013.
Which?
Open Arms Healthcare Center. And the reason it was established is because the work that My Brother's Keeper was doing with marginalized communities, providing sexual health and reproductive health education, we're saying, hey, these are all the tools you need. The next time you go see your doctor, talk to him or her about what your sexual practices are so they can create an HIV prevention program for you, an STI. They come back and say, I can't talk to my doctor.
I was just going to say, the whole thing about, we don't talk about it.
I can't talk to him. I'm not comfortable talking to my doctor about my sexual practices. My doctor knows my aunt, so I don't want her to know about and that was the birth, 2013 was the opening of Open Arms Healthcare Clinic, staffed with people that are versed in every single thing about sexual and reproductive health and primary health care. That's the objective, not to separate sexual health from primary health care. At Open Arms Healthcare Center, it's inclusive in your primary health care.
Well, don't we teach sex ed in schools? I thought we eventually got it.
Oh, that's funny.
Well,
that's hilarious.
Really?
I can't remember what year it was, but it was House Bill 999. And the intention was to give every school district the opportunity to choose whether or not they were going to teach abstinence or abstinence plus. Mississippi had more abstinence choices in the beginning, and then you had some people that, flipped the script in the middle and decided to promote or educate the students in the realm of abstinence plus. But there was no money associated with the bill. So you gave these teachers who are already overworked and, moderately paid to, to conduct this training. They weren't given any capacity building, so they're remixing it. So a lot of times the kids were getting information, but it wasn't state of the science. It was based on the theory or the priorities of the person that was teaching the class.
Well, I first of all, I have seen the books, the cartoon books, and they're gross. And I'm sorry, but that's gross. There's nothing pretty about that at all.
Yeah,
it's gross and it's insulting. Mm-hmm. And I do think, though, sex ed should be taught in schools, like like my friend from Germany, she said, well, we learn all that kind of stuff
early.
Yes, and if you're, you might be able to, if your parents will allow you to have your boyfriend or your girlfriend stay over you to that. Well, we'll never get to that. But I have felt that sex education should be taught by a medical person of some sort, and it should be clinical and taught. You don't have to do cartoons and snarky
real
and
stuff.
all that kind of stuff.
Right.
Do real stuff, but in a clinical version, so that you don't. Yes, you say the word penis, you say vagina, but you say them clinically. Like I just said, clinically. I say those words. I don't, drop them left and right. You don't. You don't speak that way willy nilly. You do it in the proper atmosphere.
Right.
But we don't do that, and I'm sure that there are all kinds of health people who would be able to do that in our schools.
It costs.
Would think.
It costs. Well, and I know that Mississippi is doing a better job of funding public education in Mississippi, so you have to, give us a little credit for that.
Oh, I do.
But that's a wonderful idea to have someone with a medical background come in, but you have to have that there's so much red tape associated with schools that, like, Open Arms Healthcare Center has programs focused on outreach and engagement, and it's difficult to actually get into the schools because of all of the red tape. So you have to create programs with other community-based organizations to get access to the kids after school.
Well, maybe you can. Oh, it would be after school, huh?
Yeah.
Maybe there is a volunteer way to do it through some of these other organizations.
That would be a wonderful idea.
I would think that there'd be a lot of medical people who it wouldn't kill them in terms of time, and they would be doing such a public service, and like I say, do it clinically and upper level, and these kids will learn.
And they're open to learn.
At home, they're not learning it.
Well, they're getting it from the internet, and like we were talking earlier,
yes, I was saying, that could be good, but
it's full of information and misinformation. Yeah. So if you don't have a trusted source, and I think that's a wonderful idea, especially someone locally that can tell you, hey, I have a clinical background and I'm invested in this community. I want to share some truths with you about sexual and reproductive health.
It could be. Listen, Jackson is on a roll. Neither one of us live in Jackson right now, but the city's on a roll, and that could be even just part of it. And I hear people talk about, this great education enlightenment that they've had in Mississippi. I don't know how big that was. We've
small steps. Hey,
yeah. Well, I think our
progress.
Steps, it makes it sound like we took these giant steps like this. I think we've taken some small steps. Well, we could take some even further small steps. But a lot of adults don't know.
Yeah, that's true.
That's the thing. We're just talking about kids. It's not just kids. Adults don't know, and I don't understand how they don't know.
Well, we don't talk about it. Again, if you're with your intimate circle of friends and you're talking about STIs, but you keep that secret. We're not talking about it in public. We're not talking about it with captive audiences of people who suffer the most with these conditions. We're just not taking advantage of the fact that everyone is really looking for an expert to just explain it all. But it's a secret. It's the biggest. It's almost like a secret in a glass box here in Mississippi. Our STI rates are astronomical. We're competing on a national level, and it's unfortunate because we have so many other health disparities that we have to deal with: obesity, diabetes. We have higher rates of Alzheimer's disease. So getting people into primary care that's comprehensive, and again, I'm going to say at Open Arms Healthcare, that's the intention. 1, to serve the underserved first. 2, to create a comprehensive wellness center. So you come here and you get your primary care, your health and your sexual health and reproductive support, mental health support, food pantry.
Where is it?
Open Arms, 805 East River Place. Do you know where the old Y used to be off of Fortification?
Yes.
Yeah, it's right there.
It's right there? Good, because I think people will be saying, well, where is it? And by the way, speaking of medical, et cetera, I have Dr. Jennifer Bryan coming on the show tomorrow, next Friday.
Awesome.
You know her. I'm sure you know her. And there's other things to talk about, but this will be included because, we spend a lot of time during COVID, and now we spend time with her as things pop up. And there's some things that that she's got to talk about, and some things me too. But that certainly, this will be one of them.
Good.
So Open Arms, is it how 24/7?
No, Monday through Friday. They have an extended day on Thursday, 8 to 8, if I'm not mistaken, and a short day on Friday, 8 to 12. And all of the physicians and nurse practitioners and public health experts are versed in everything health. It's, again, a comprehensive conversation. So I know that some people have gone to the doctor. I remember, and I had Blue Cross Blue Shield at the time, I wanted to get a full panel. I told them I wanted to get, it's not included in my insurance. I was going to have to pay out of pocket for it. And I think that's odd because during flu season, everyone's saying, get your flu shot, get your flu shot. It's STI season in Mississippi. So you should be encouraged to get a syphilis screening. You should be encouraged to get, the gonorrhea and chlamydia screening and HIV, but that's not the case. And it should be. It should be primary for you to get those STI screenings in Mississippi.
By the way, you say STI, which
sexually transmitted infections.
Because we hear STD.
Sexually transmitted diseases.
Let's talk about STI. Okay, gotcha.
There we go.
Okay, so just
which
to make
is
sure.
an evolution of VD, which was venereal disease back when I was younger.
Still around.
Yeah.
I mean, all that stuff is still around.
Yeah. And we're really not, again, doing a good job of talking about it.
It's not. As adults.
As adults, we're not talking about it.
When you go out to dinner with friends, you're like, well, let's have a discussion about STIs.
Well,
that doesn't exactly happen. It should.
If I gain weight, and there was a time when I lost weight and I was small and no one, they were like, oh, you look so great. But then when I started gaining weight and I saw it and I knew other people's, but no one wanted, said anything like, oh, wow, you're gaining weight. Health disparities, period. We just don't talk about them, especially those disparities that we believe are your fault. Like diabetes is not a fault disease, but obesity is.
Yes.
Alzheimer's is not a fault disease, but syphilis is. So we don't want to talk about those conditions that we have decided that this is your individual fault.
Isn't it? It's regarding obesity, it's very sad when you see obese parents and their children are nearly obese, and you just want to stop and say, excuse me, but it's one thing if you're killing yourself, but don't kill your child.
How? And we don't say that.
We don't say that. If you said that to somebody, are you kidding me?
Get socked in the eye.
Yes, absolutely. But they don't see that.
Yeah, but we have to do in Mississippi that has higher rates of all of these disparities. And we have the reputation for being compassionate and hospitable. We have to figure out our way to also be clinical. The facts that we know, and share those things not based on emotion, but based on scientific data, and have conversations like that. That's compassion too.
Absolutely.
Yeah.
Wow. You got a big job ahead of you to knock this stuff down, to explain it, and hey, let's stop. You did do a story, like I said. I don't know if you're on WLBT, but you're on WAPT, and so I came across this article the other day, and I said, I didn't see the story, but it was online. Yes, sir.
I just wanted to also highlight that she is an actress, I think, and does a lot of work with the Fondren Theater.
Are you telling my business?
I'm trying to. Yeah, I'm trying to shed a little light on this multifaceted, amazing woman.
Oh my goodness! Well, I've done some work locally with New Stage Theater. When I was at Jackson State, I did several.
We do a lot of people with New Stage.
Yeah, The Color Purple.
That's the one I wanted to ask you to tell me about. One of my favorite movies. Yeah, I saw that.
Yeah, that was a wonderful experience. The students at Jackson State are just phenomenal characters. And Dr. Mark Henderson was the director at the time. And
you want to hold the thought, and we'll come back. We'll take a break. We'll come back on the other side of this break.
Awesome.
I'm fascinated with this. Good for you. Stay where you are. And here's my favorite song, by the way.
Give it up.
Well, there's one song that I can think of that you can readily identify with just one chord. And I can't play it. I can't tell you what but if you were to hear it, you would know that. No, I don't usually know a whole lot of music, but come on, Marvin Gaye.
Right, classic.
It's fabulous. And his best work was Marvin Gaye at the Palladium. Oh, it was live stuff. It was absolutely great. In the studio is Deja Abdul-Haqq. She is director of My Brother's Keeper. It's a non-profit organization that focuses on public health, and we've been talking about syphilis and STIs, as she calls them, sexually transmitted infections. But we also Lance went online, looked up. So I just want to finish up this conversation talking about that you have acted at New Stage.
Yes, and I'm really upset with you for getting into my business and putting it all.
Oh, it was right there. It was front and center.
Honestly, it was again the work started at Jackson State, and then after I graduated, I had an opportunity to do several shows at New Stage. Interestingly enough, I'd done the Christmas Carol twice. Once I did it without being pregnant, and the second time I did it pregnant. I played Scrooge's sister, Fan, and I remember one of the lines was, "I have a surprise for you, Scrooge," and that was the running joke. The surprise was this baby that I was hiding under all these heavy clothes.
Did you show how pregnant were you?
Well, they were able to mask it with the dresses and the drapes. But I'll tell you that there's something interesting about theater that actually eases the tension about conversations that we, can't have. It's a wonderful tool to use. I remember there was a group out of New York that came down and did an immersive theater experience, and they were talking about HIV stories and learning that you're positive, and it took a lot of the weight off of the uncomfortable conversation. So theater is a wonderful tool to use to educate people about things that they're uncomfortable about.
Absolutely. Well, then talking about people getting screened, you mentioned, we were talking about that a little bit too before we went to break. People getting screened because it'd be like, explain where you can get screened and the cost. And people also need to understand that there's a confidentiality between doctor and patient. You know, I mean, the doctor's not going to call up somebody and say, hey.
Well, that's not true, Mary. Yeah.
Well, they're not going to call.
Sometimes that's HIPAA violations that happen in smaller spaces.
Okay.
You know, because the accountability, you know, the accountability component isn't necessarily there in some of these small rural spaces. So it does happen in some instances.
Not always.
But yeah, but it's not in larger spaces, in rural spaces where the community is more intimate. And yeah, in some instances that does happen.
Well, if you say to your doctor, if you're living in a smaller town,
right? If
you live in a smaller town and you think you really need to go to your doctor, or you're going to your doctor for something else, and you want to talk about, how about if you said to your doctor, I want to have a conversation with you that must remain between us, doctor-patient confidentiality. Can you do that for me? Because it'll be about sex, and if he or she says no, I can't, or yes, I can, or whatever. You can do that, of course. I mean, you have to have faith in your doctor.
You should, but if you're my doctor, and this is no slight to you, because there's some instances, like I was mentioning PrEP, the pill you can take once a day to prevent HIV. There's some doctors that are not well versed in that. So if I go to my doctor and say, hey, I'm interested in trying PrEP, what is PrEP? Oh, yeah, that's not for you, or you're a woman, you don't need PrEP. They don't. So there are doctors that, again, just like us, you go through medical school, no one is teaching you to be culturally competent, as it relates to HIV. That's not a standard. It should be in Mississippi, but it's not. So you are dealing with someone who is operating in arrogance or ignorance. Ignorance is, I really am not well versed in STI prevention, or, arrogance is, oh, you're exposed. You're living a life that I don't agree with, and that I'm really not going to be as receptive as I should be as a clinical provider.
Oh, wouldn't you be horrified if your doctor said that to you?
Horrified, and then not go back. Imagine that. I test positive. I don't have a positive experience with my doctor. He's not well versed in HIV care. I don't go back to the doctor. That becomes part of the problem, because if I'm HIV positive, and a lot of people don't know this, and I stay on my ART, I'm on my meds, I'm going to get regular care, I become what they call undetectable, which means that I was
terrible.
No. That's awesome.
It is?
Undetectable means I'm going to screen, and there may not be a positive reaction because the viral load in my system is so low that I'm undetectable. And if I'm undetectable, I'm untransmittable, meaning I will not transmit the virus.
Oh, well, that's but that's rare, I would think.
No,
but
that's not rare.
Common.
People that are living with HIV that are in care. And we have to do a better job of creating a space where people feel comfortable talking about that. Because if I'm positive and I'm in a group of people that, I don't feel comfortable talking about it, I don't have people encouraging me, you need to get to the doctor, you need to stay in care, you need to take your meds. What are your viral loads looking like? How are you feeling? That's compassion, and compassion is part of the solution. But right now we have a problem with stigma associated with sexually transmitted diseases.
Still.
Syphilis included, HIV, all of them. Yeah. And the stigma is, you did something, you're beneath me. This is something that's your fault, and it's, whatever it is, it's curable and treatable.
What is our status regarding AIDS? Don't hear much about HIV/AIDS.
Mississippi, like I said earlier, ranks 4th in the nation.
So that has not gone away, folks.
At one point, Jackson had the 4th highest rate of HIV among American cities, not states. Over 19,000 cities in the country, and Jackson was ranking 4th. But we actually had a really good push with support from the federal government and resources to educate people about HIV and get everybody screened. So all of these HIV prevention dollars were focused on getting people screened, and we were seeing more people come in to get screened, more people getting into care, which is a part of the solution. But recently, the prevention dollars have been paused in many spaces. I know for us, there was a pause for funding for the past 4 months. We've actually had to deal with furloughs in the organization because of the pause in funding. But the rate of HIV was so serious that you really couldn't take those dollars away because of the epidemic that we have in the country, specifically in the South, particularly in Mississippi, and on a very intimate level in Jackson.
I can just hear some people saying, there are some people out there who are very needy in this audience, and I recognize that. But also there might be some people who say, well, just quit having sex, then you won't have these problems.
Who wants to not have sex?
Well,
Who wants to not have? Well, that's for no. I'm a proponent of good, healthy sex. Everybody should be having it. If you don't want to have it, that's you. But if other people want to have it, let's give them the tools they need to have healthy sex.
Well, that's just it. If you're going to do it, then make sure that you get screened, do the right thing,
get screened.
And where do you go to get screened again? That can come to.
Well, here's the challenge: the STI dollars have been paused. So a lot of the screenings that we were able to do at Open Arms Healthcare Center, the syphilis, gonorrhea, chlamydia, the funding resources have become complicated. So, but of course, you can still come to Open Arms Healthcare Center to get those screenings. You have to pay out of pocket, or it could be covered by your insurance. In the past, we were able to offer those services at no cost out of pocket.
Well, how much would it be if you're like,
that's a good
if you're not
question.
because if you're older, you're not a kid, but you're a little bit older. You might be in your 20s or whatever. How much would that cost you?
Either your insurance is going to cover it, or at Open Arms Healthcare Center, they have sliding fee scale. So it'd be based on your income. So it would not necessarily be a flat fee for everybody, but it would be based on your income.
And if it's based on your income, then that means you would be getting a bill. And so there is
and the labs, in the past, all of that was covered by the federal government.
Does that worry some people about confidentiality? Like, well, my dear, why are you getting this bill?
No. At Open Arms Healthcare Center, what happens is if there's anything it's a primary healthcare center. There's nothing that's going to come to you that says this is a product of you come and get an HIV screening. It's a healthcare center, so it's just your doctor sending you a doctor's bill. No indication of what the actual.
You can keep that. Boy, we are in a mess. It's such a basic thing, sex, and it's such a mess.
Well, yeah, it's not like people are going to stop having it, and it's
no, that's just it. Well, but that there are some people.
It's healthy to be in a relationship and be healthy in the things you do, and
there are
sex
some
is a
people
part
who are
of that.
very I don't know how to say this. I don't want to be insulting, but they consider themselves overly moral, and that it's immoral if you're not married having sex.
Exactly.
That's the thing. I mean, but people do have sex. That's what I was just. But not abstinence is certainly a cure, but is it very realistic? And what is abstinence?
Well, the data
plus?
tells the abstinence. Okay, so those curriculums we were talking about, abstinence is teaching just abstinence, saying that all of these STIs, you don't have to worry about any of that in detail. Just don't have sex until you're married and you're good, which is not the truth. Because a lot of times, if you say, okay, if you don't have sex until you're married, then you don't have to worry about it. If neither one of you had an HIV screening, who's to say that my spouse or my wife or my bride or my groom has, been abstinent the whole time too? Have an HIV screening with my ex-husband, who's a great friend now, but that was our first date. We went to go get screened.
Let me ask you a question here in tandem with what you're talking about. What are the long-term effects of carrying one of the sexually transmitted diseases and not being treated for that?
Let's speak about syphilis since we're talking about
but to the personal health of that individual.
I put on my Twitter X. I put a couple pictures on there, and I showed those to Deja this morning. One of them is a tongue, and it's enough to make you ill, and the other one is hands. It's hands with some spots, but syphilis can make you crazy.
Yes, there was initially you can have syphilis and not have any symptoms.
Who?
Hitler
had it.
Yeah. Interesting.
Oh, and even before him, a couple of years before that.
He had it most of his life and had struggled with it. He had, from the prostitutes of World War I, and it was something he hid for a long time, but went untreated, and even then they didn't have treatment per se for it.
But there was a king too. There was at least one king who was.
Definitely.
I don't know which one it was, but
even right now, there's a report that says the soldiers in Russia they're experiencing a spike in HIV, and they're associating it with fatalism. People that are saying basically my life is valueless and I'm just going to gamble with it.
Wow. Isn't that sad? That is sad and sick.
But as it relates to syphilis and its stages, the first stages you may not have any symptoms. Those pictures that you show, there's probably third stage syphilis. And, with the lesions on your hands and your tongue.
Awful.
But it can progress to the mind and create, dementia. And so, you don't want to. It's not something that you just want to live with. You want to get it treated, but the only way to know early if you have it is to get screened.
And then you get your screening, and it says you have it. And then what happens?
Penicillin.
Ah, okay.
There you go.
No, it's not. Yeah, see, it's not so mysterious.
No, that is exactly what I wanted to hear. Is like once you are identified as having this issue and you're carrying it, obviously, if you go untreated for an amount of time, you're going to have worse symptoms.
Exactly.
But the actual treatment for it is not as prohibitive as we would sometimes think it would be.
It is not.
If you are at the lesion stage, are you still eligible for penicillin?
Yes.
Oh, okay. Well, how about that? Did not know that. I mean, we don't want to tell people what to do.
Well, you don't want to wait.
But don't mess around with this stuff.
Get screened early.
Absolutely. Well, listen, this is fascinating. I've got to bid you farewell. I do want to do something. I want to pass along to the audience a conundrum about water. If we can get, if it's still available, I hope it is. But yeah, listen. So don't be afraid. Get screened. Call for help. How do you get a hold of My Brother's Keeper?
601-500-7660. That's Open Arms Healthcare. That's the clinical arm of My Brother's Keeper. They are well versed, and they can get you in to get screened. They can get you in to figure out which insurances cover the screenings. And again, like I said, there's a sliding fee scale.
Oh, let's hope it makes a difference, really.
Every day it does. Thank you so much, Mary.
Well, listen, thanks for coming on, and keep in touch with us, okay?
Will do.
We'll be back for our final segment. Stay with us. Well, we were just talking about. Amazing, everybody. Don't be scared to get tested if you need to do it. Just get it done. And places you can go to. And if you need to know the phone number once again to talk about it, it's 1-800-500-7660. So I was up in the middle of the night. I often don't sleep the night before I do a show. And I did the promo, and then I was just looking around online what was going on. I hadn't seen this in the news yesterday. And so I came upon this headline this is the WLBT website. Hennepin blocked from treatment plant as firm protests termination. I'm like, what is this? Okay, so this is it's a lengthy piece, and it's kind of confusing, so I'll see if we can get through this and understand it. A ploy to protest Jackson Water's plan to hire a new firm to run the city's wastewater treatment plants Thursday landed its operators in federal court. I'm like, what? The city has a firm that runs wastewater treatment? I did not know that. Never heard of that before. I thought it was all part of the water system. Well, so Judge Henry Wingate called a status conference for Thursday afternoon after he was informed that Veolia North America had blocked interim third-party manager Ted Hennepin from accessing the Savannah Street wastewater treatment plant. Okay. What? Who is Veolia? Veolia. Veolia would be Veolia. You've never heard of this either, have you? You have no idea what I'm talking about. No. Veolia North America blocked the Hennepin, the third-party manager, from accessing the Savannah Street. You always hear about the Savannah Street. Oh, they dump water in the river and you can't go swimming and fishing beyond such and certain points.
And that's Savannah Street, South Jackson, correct?
Yes,
okay,
that's the one. Sure. I thought that was all part. Hennepin, and now here's another one called Jacobs Solutions staffers with Hennepin were supposed to meet there to discuss the transition with Veolia. What is it? What?
Too many cooks in the kitchen, it sounds like to me.
It's terrible. However, Veolia Vice President of Operations Matt Johnson met Hennepin at the gate and told him he wasn't ready to meet and he couldn't access the property. The guy goes, well, this is an opportunity to pause what Jackson Water was trying to accomplish and work with them about the concerns and issues we're seeing, this man told the judge. Whether right or wrong, I apologize for creating chaos that didn't need to exist, but I thought it was the only way to bring it to your attention. He also told the judge that Jackson Water currently owed Veolia about $4.2 million and had not made a payment since March. Jackson Water wants to push this transition meeting rather than discuss the issues first, said this guy Johnson. So Jackson Water owes $4.2 million to somebody. It's no wonder the water system is in a mess in Jackson, for heaven's sakes. And no wonder people are getting these awful bills.
Well, you got the other story, too. The other story, the Blossom Apartments in Jackson.
Well, yeah.
With the $400,000 worth of unpaid water bills by the owner. The folks that live there have no water because the owner said, I'm not paying it. I can't pay it.
Well, thank goodness for the Jackson Fire Department bringing non-drinkable water so that people can go to the bathroom, for heaven's sakes. And then
there were several kids that just couldn't go to school. And
they couldn't get a bath. But then there are other organizations, and I don't know who they are, and companies bringing drinking water for these people to have. But so you got this crazy stuff going on about the wastewater treatment plant. During more than an hour and a half of proceedings, Judge Wingate asked this guy Johnson about his concerns, but admonished him and others, saying that Hennepin, as a third-party manager, has a nearly unfettered right to access the city's water and sewer properties. Well, I must say, I would think so if you're charged with the water. At the heart of the matter is Hennepin's decision to end the city's nearly decade-long contract with Veolia and replace them with Jacobs Solutions. Okay, this business of Veolia running the treatment plants has been going on since 2016. Never heard of them before. And all the shows I would do,
doing a great job.
The shows that I would do with the public works guy, because Robert Miller was the best guy.
I've never heard of them. It's the first time I've heard of Veolia.
I did too. Like, what? Who are these people? And why do we have to have that? I mean, Veolia took over the management of Jackson's Savannah Street, Trahan, and Presidential Hills treatment plants in early 2016. I've heard people say Trahan. I didn't know what they were talking about. But okay, so that's what that is. But according to the contract, that firm would be paid $11 million a year for 10 years to manage the city's plants and pumping stations and to help ensure that Jackson complied with its sewer consent decree. Oh, that's another thing, the consent decree with the feds. That's been going on for years. The firm currently charges Jackson Water about $14.8 million a year. That's about $830,000 more than the proposed contract with Jacobs. Okay? The firm would be paid $11 million a year, this is Veolia, for 10 years to manage the plants. They currently charge Jackson Water about $14.8 million a year, $830,000 more than the proposed contract with Jacobs. It's only proposed. For his part, Johnson, with Jacobs, told Wingate ending the contract early would cost ratepayers between $1.2 million and $1.4 million in demobilization costs. Honestly, people who are just trying to get some water to people and trying to process, toilet water and all this stuff. And we have to go through this. My question, why go through this and pay a premium with so little time left in the contract? He said, I don't see the business sense behind it. Johnson also touted the firm's efforts in the last year and a half to improve conditions at the Savannah plant, including investing in training for the plant's 35 employees. You're like, Mary, Stop it. Stop doing that. But this is fascinating. It's almost not understandable. We have to get through this and try to understand a little bit about this, because we have to know when they start talking about this stuff, we have a sort of an idea of what's being talked about. Well, let's see. He tells the judge.
This Veolia company is a resource company, treating pollution, optimizing resources, minimizing client impact, developing and implementing environmental solutions for over 170 years.
Where are they located? Where's their
North America is what I'm seeing right now.
Yeah.
And let's see about. They don't tell you a lot. They don't want you to know a lot about.
Yeah,
them.
really. All this has been going on since 2016 around here. This guy Johnson apparently told the judge that despite what happened on Thursday, Veolia would still like to compete for the city's business and would like Jackson Water to issue a request for proposals to get the most competitive price. That's an RFP. You ever hear people saying, we got to get an RFP, request for proposals. Hennepin countered Johnson's claims, saying the city would face similar demobilization costs even if the contract goes to term. We would be responsible for the same costs we have for early termination. I don't find that convincing.
It looks like New Jersey would be their domiciled state, with offices in Pennsylvania, Rhode Island, Delaware, New York, and Boise, Idaho.
How in the heck did they get down here? They're in New Jersey?
Jersey.
Oh, my God. You know what happens Boise. Up in Jersey?
Boise and Jersey, yeah.
New Jersey. The demobilization and pulling away from this costs include, among other things, employees' severance pay. Hennepin said there would be no need for severance because those employees will immediately be hired by Jacobs. And here's Lynette Baker, Senior Director of Operations and Maintenance with Jacobs, told the judge that Jacobs wants to hire all the current employees at the Savannah plant and plans to begin processing them next week. In the industry, we call it badge flipping. The transition can be difficult, but we try to make it easy for the staff so they'll get a paycheck and benefits from the start. Our goal is to have all 35 starting on October 1 with a Jacobs logo on their shirts. Okay. Now let's see what more we have.
We're talking about water here, right? Still,
we're talking wastewater, not just ordinary.
Goodness gracious!
Well, isn't it nuts? Hannafin also refuted Johnson's claims that Veolia was doing a good job, saying that the firm had neglected the city for years, leading to hundreds of prohibited bypasses at the Savannah plant. Those bypasses occur when wastewater is diverted around the plant's treatment processes and released into the Pearl River untreated or partially treated. Oh, man.
Well, there was a lot of reports that there was untreated water, millions of gallons
that's
going
what that is.
Into the Pearl
Well,
River.
that's what it is. It's bypasses. It's a fancy word for untreated water. For years, much of the Pearl and the metro area has been under a contact advisory as a result. It's unclear when that advisory will be lifted. Contact advisory.
Like it's okay to drink it and bathe in it, but don't touch it.
Well, and if you cook it, make sure you boil water. No. That was the driving force, but we didn't want to fire them for cause because that would be damaging to them.
Who cares? If they didn't do a good job, they should be fired.
Hannafin was appointed third-party manager over the city's water system in 2022. He took over the Jackson sewer system the following year, 2023. So Hannafin's in charge of all of it. As manager, Hannafin can enter into and end contracts on behalf of the city. However, he is required to consult with city leaders before entering into a long-term contract, and it goes on and on and on. We don't know. And all credit to WLBT for doing this story. Don't know how it's going to end. If we know something that we can figure out and pass along to you, we will do that. All right, so have a good weekend, and see you next week.